Well, I had several issues with my elbow. It was really more event-driven. A couple of times once when I played golf and once when I'm swimming. When I was swimming, my straightening my arm in a swimming stroke and also in a golf stroke down here, it actually jammed. I could feel a body in a bone chip or whatever inside my elbow had jammed, and it caused enough pain that I had to stop. It was pretty severe pain.
A lot of times they complain of catching and locking symptoms through their range of motion of their elbow, a restriction on range of motion of their elbow, and pain at the extremes of range of motion. So whether that's extension or flexion of the elbow, their pain is activity related and causes them to catch the elbow as they're moving through their motion.
It wasn't until I saw some doctors that I actually realized I had lost a lot of my range of motion. So typically you go from 0 to about 140 degrees, and at the time I really hadn't noticed directly that I'd lost so much upward flexibility. I'd lost about 15 degrees down, and I'd lost probably 45 degrees up.
I evaluate them based on their range of motion and their examination, check for stability of the elbow and any evidence of dislocation or old traumatic injury or new traumatic injury, measure their range of motion and the strength of the extremity in question, determine what activities and what positions cause most of their discomfort, and then perform standard X-ray imaging initially, and depending upon those findings, recommend conservative management versus further imaging depending upon their symptoms. Conservative management would be use of oral anti-inflammatory medications, restriction of the activities that are interfering with their life, and also physical therapy to help regain as much range of motion as is possible. Occasionally, they can be managed with corticosteroid injections into the elbow to help with their inflammation, should it be severe enough to require it. Range of motion activities with therapy are probably the most important activity, because you want to maintain and in some cases improve their range of motion to their maximum ability before you would undergo surgery, because what they have before surgery is often a good guide for what they will get back after surgery.
I had a big bone spur too, and a muscle mass that damaged the joint. He can't repair that, but at least he removed it so I would get the range of motion and it wouldn't cause more damage. It was actually a very large body. It's probably 50% bigger than anything I'd ever done. When I went into the surgery, we were going to give that a shot, but if he couldn't get it out through arthroscopic, he was going to have to take one of the more traditional routes. So when I woke up, I wanted to know immediately, was it able to be removed through arthroscopic, and he said it was able to be done.
Therapy is an absolute necessity in postoperative elbow surgery treatment, as the elbow has a very high capacity to become stiff and malfunction and scar after surgical intervention. He did remarkably well with that request and pushed himself to regain near complete extension and to regain 137 degrees of flexion, which 140 degrees of flexion is normal elbow range of motion.
My physical therapist was very instrumental in helping me, not just through the technical part of the physical therapy and the recovery, but also motivating me to do the exercises, gave me a good plan to see, and also not to overdo it.
For a hand and upper extremity surgeon, having a hand therapist on staff and readily accessible to you is not only important, it is vital. Realistically, I could not function and do my job for my surgical recovery of my patients without a hand therapist present, specifically a certified hand therapist who usually has an occupational therapy background and training. So hand therapy and working closely with one is vital. And to that degree, I have flooded my hand therapist with postoperative patients. And she is very busy and very good at what she does, and as is the hand therapy staff of the other branches of Commonwealth.
It has improved a great deal. The flexibility, I'm hitting the ball way out further off the tee, probably 20, 30, 40 yards than I was before the surgery, which is where I was before. As far as swimming, my kicking has gotten a lot stronger. My stroke is getting better. I'm probably about 95% of where I was. So I've looked at this as an opportunity to correct some major flaws or some minor flaws, depending on your point of view, in both golf and swimming.